Hi everyone, today I am giving you information on the topic Mysthania Gravis. So let's move to its description. Mysthania Gravis is a neuromuscular disorder that causes weakness in the skeletal muscle which our body uses for its movement. So Mysthania Gravis is basically a neuromuscular disorder which affects the nerves as well as muscles that cause weakness in the skeletal muscle which our body uses for its movement. So directly you can say that Mysthania Gravis is directly related with the movement of the body. It occurs due to the breakdown of a communication between the nerves and muscles. So in this disease, the communication between the nerves as well as muscle get affected. It get breakdown due to which miscommunication takes place between the nerves and muscles and the body movements get affected due to this. It is an autoimmune disease in which our immune system mistakenly attacks on our body due to which antibodies are formed. So it is an autoimmune disease in which our body get attack on the immune system due to which the antibodies are formed. Due to the formation of the antibodies, not proper messages get passed on from the nerves to the muscles, due to which abnormal or different kinds of movements get takes place in our body. Next one, back to basic ones. Neurons is related to the nerve cells, muscular is related to the muscles. Neuromuscular means a junction which is present between the nerves and muscles. When the junction between the nerves and muscles work properly, then our body can perform the movements very easily. But if the junction between the nerves and the muscles doesn't work properly, then the body movements get affected. Okay. Next one, normal condition. First of all, the message get released from the brain when it reaches to the last neuron. Okay, first of all, our brain sends the message to the neurons that this movement or this body movement the body have to perform. Okay, you all know that this one is the nerve cell, it is a neuron. Okay, so this one is the nerve cell and this get enlarged here. Okay, this one is the neuron. As the body as it the message get, this one is the message, it get reaches to the last neuron. Okay, then chemical acetylcholine get releases. Okay, acetylcholine, so these are the acetylcholine, this get releases at the junction between the nerves and muscles. Okay, this one is the muscle junction, this one is the nerve junction, and this is a space between them. Okay, in this space the liquids or the complex get formed. So let's see, if we want to move our hand, then a chemical releases acetylcholine in the last neuron. Okay, if we want to perform any kind of movement, for example we have to move our hand, then a chemical acetylcholine get reaches to the last neuron, then it get passed towards the neuromuscular junction. Acetylcholine get stick to the receptors of the muscles and a complex is formed. Okay, so acetylcholine get releases here and it get moves to the sticks to the receptors. Okay, it get sticks to the receptors and a complex is formed. Then that complex moves to the muscles junction. Okay, and the movement get performed easily. Okay, but in case of abnormal condition, when the message releases from the brain and reaches to the last neuron, chemical acetylcholine releases and pass through the neuromuscular junction, but it can't properly react with the muscles. As a result, some message get passed on through the receptors because antibodies are formed there and we are not be able to perform the movement easily. Okay, in case of abnormal condition, as the message get reaches here, so antibodies are formed. Okay, antibodies are formed and they are not allowing that complex to move to the muscle junction, due to which abnormal movement get takes place or the slow movement get takes place, due to which there is a miscommunication between the nerves and muscles. Okay, so antibodies get formed there due to the attack of the immune system on our body. This was the abnormal condition. Next one, symptoms. What are the symptoms? First one is the drooping of eyelid. Eyelid gets drooped down. If you are noticing here, this one is the right eye and this one is the left eye. Okay, in case of right eye, the eyelid gets drooped down, upper eyelid is moving down. Next one, double vision get faces due to it. The patient faces the double vision or perceives the double images. Fatigue is the tiredness, difficulty in bending neck, difficulty in swallowing and chewing, difficulty in walking, eye movements become slow. Okay, so difficulty in swallowing and chewing because the shape of this side get changed due to the weakness of the skeletal muscles. Okay, so move to the next one. What is the diagnosis? Checking your reflexes. For example, picking a cup of tea or a coffee. What is the speed of picking that thing? Eye movements work properly. Eyes have to move in all the directions, up, down, left, right. Testing motor function like touching your finger to the nose. Blood test for antibodies associated with the Mysthania gravis. Next one is the treatment. Medicines like neostigmine, predostigmine given which act against the enzyme and break acetylcholine. Okay, acetylcholine receptors get break here due to the use of these medicines. In this way, the acetylcholine increases and the symptoms get improved. They starts producing more and more acetylcholine, due to which, if the movements get blocked or antibodies get blocked down the message, then also it get passed on through the muscle junction also. Steroids like prednisolone is given. Thymectomy. Thymus produce antibodies, so the thymus get removed. Next one is the blood transfusion. Bloods get transfused from the one person to another. This was the end. Thanks for your patience listening.